opioid database that's maintained by the Drug Enforcement Administration is being made public for the very first time.
Now, this database actually tracks every pain pill sold in the U.S. That's from manufacturers to distributors and then on to pharmacies in every city and county in the country. And between 2006 and 2012, there were enough prescription painkillers distributed here locally to give every person in Nueces County 39 opioid pills a year. Over in Aransas County, that number was 44 per person and 39 pills per person in San Patricio County. So how are local authorities and officials responding to the release of this information? Well, our Emily Hamilton sat down with a local physician to get some answers to those questions.
The newly released information is essentially a roadmap tracking every single pain pill distributed in the U.S. Reports show in that time, pharmaceutical companies distributed enough prescription pain pills to supply every adult and child in the country with 36 each year. Local experts say they've witnessed a domino effect.
When those prescriptions run out, they are physiologically dependent upon opiates, and they move on to other drugs, heroin, fentanyl, other things, anything that can get off the street.
A county-by-county analysis of the data shows the places that were most affected by oxycodone and hydrocodone prescription pills distributed across the country over a 7-year period, more than $76 billion in all. While Texas is not one of the states most afflicted by our nation's opioid epidemic, Dr. John Lucen says our local numbers are still concerning. As a psychiatrist, did those numbers alarm you?
Yes. Seeing that map, I see these patients every day. I see these patients come in and we talk about chronic pain every day. But that number, it's high.
He says oftentimes psychiatrists are left to pick up the pieces after patients become dependent on prescription pain pills.
Because getting off them and finding alternatives and withdrawing and what it can happen to your family and to your life is terrible.
Emily Hamilton, Chris 6 News.
Dr. Lucen's also mentioned the launch of a new program through the Corpus Christi Medical Center, which provides alternatives for pain management.
It's called ALTO. It's an acronym, Alternatives to Opioids. And we have all that information regarding the ALTO program on our website, christv.com.